Hi, my name is Michael Ye from UCLA Health. Here we have a commitment to your safety, and I'm here to give you a brief update on what we're doing and what you can expect if you come to visit the UCLA Endocrine Center in the time of the coronavirus. First, when you call to make an appointment, you'll be asked a series of screening questions, such as, have you experienced any of the following symptoms in the past 14 days? Fever or chills, cough, shortness of breath, sore throat, fatigue, muscle or body aches, loss of taste or smell, nausea or vomiting, diarrhea. Number 2, have you been in contact with anyone diagnosed with COVID-19 in the past 14 days? Number 3, have you or a member of your household been tested for COVID-19 in the past 14 days? And if so, did anyone have a positive test result? If you say yes to one or more of these questions, we're going to ask you to see your primary care provider. Next, we're going to say hello to Edwin, who's our screener today. He's going to ask me a series of questions and then take my temperature. Hey, Edwin.
How are you today?
Good, thanks.
Any symptoms of COVID today? Fever, cough, fatigue, chills, diarrhea, sore throats?
Thankfully not.
Okay. 97.3, you're good to go.
Awesome. Now, we encourage everybody to bring their own mask, but if you don't have one, you'll be offered one here.
Here's the mask for you, sir.
Terrific. Now, if you're offered one of these paper masks, it has a little wire on the top. A pro tip is to pinch that over your nose so it goes over the bridge of your nose and under your chin, and you'll be all set. We encourage our patients to use hand sanitizer throughout their visit. You'll see many dispensers around the clinic, and we'll be doing the same thing. The UCLA Endocrine Center is located on the 3rd floor of the Medical Plaza 100 building, Suite 310. Here we are. Hey guys.
Hello.
Jed is here, and he's going to take my temperature a second time. How am I doing?
96.9, you're good.
Awesome. This exact practice may vary from one UCLA clinic to another. As you can see, we've rearranged our waiting room to maintain physical distance. Our preference is that you not wait in here at all, but rather be taken directly to an exam room. Let's go. Thanks. So here in this private exam room, you and your family members will undergo the registration process. Next, let's go over what to expect if you intend to schedule surgery here at UCLA. First, you'll need to get a COVID-19 test. This is typically done using a nasopharyngeal swab. This is a long Q-tip that goes inside your nose to the back of your throat. These test results are run at a number of UCLA sites, and results are usually available within a day. 1 to 2 days after that, people will show up for surgery. As of mid-May, UCLA Health is open and available for all medically necessary procedures and operations. We realize the importance of having family and friends close to you during your scheduled case. While we do have visitor guidelines in place, a member of your healthcare team can answer your specific questions about bringing visitors with you. For our most up-to-date visitor policies, please review our COVID-19 visitor information on the UCLA Health website, as these policies are updated frequently. One of the biggest questions on everyone's mind is, could I potentially be exposed to the coronavirus when I come to the hospital? I've already shown you a number of things that are being done differently here at UCLA Health, such as screening questions for patients and staff, temperature checks for patients and staff, universal COVID-19 testing for everyone coming in for surgery or a procedure, universal masking, improved hand hygiene practices, physical distancing in all shared spaces, enhanced disinfection and sterilization procedures, and updated visitor policies. In closing, staying healthy now is just as important as it ever was. As you can see in this video, we're following the most rigorous standards to make sure you feel safe and that our teams here at UCLA Health are poised to meet your every healthcare need. Please call us with any questions or to make an appointment. And as always, thank you for your trust.